Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Tonsils, as we all know, is a part of your throat, right? So when there is an infection in the throat, it also means that the tonsils are infected. If the tonsil infection is there, it doesn't mean that only those tonsil lumps are infected, it is the entire throat will be infected. They are in continuum as a part of the throat. So there is no separation between sore throats and tonsils in the real life situation. Now, what are the causes of frequent sore throats or frequent tonsillitis? Now, throat, as you know, is pretty well exposed to the breathing air in and out and your whatever food or liquids that we are consuming. So there is a good possibility that the infection can come in through the food or through the droplets that we breathe. Somebody infected in the same room or cabin where you are coughing and sneezing, those droplets flying in the air will contain bacteria and viruses which may settle down into your throat and then trigger an infection. Of course, your immune system is there, it usually takes care of it, aborts the infection at a certain level and then it doesn't get worse beyond that. But however, there are times where the infection sets in and flares up. So there is nothing really that you can do to prevent such a scenario, right? You cannot wear a mask 24/7 which will give you effective coverage, nor can you live inside a bubble, right, of clean air. So it's also in a way good that you get exposed to these kind of infections, every now and then. So the immune system develops information and its defense. Right, only when you are exposed to a particular virus or bacteria that your immune system will become aware of it in the first place and then it will prepare its defenses, right. So if anything more than 3 or 4 infections a year is happening, then we need to worry about sore throats or tonsils infection. If it is less than that, it is not really worth bothering about. 1 or 2 infections a year has become a norm nowadays owing to the pollution and overcrowding, the constant exposure to all these things, our stress levels, the type of food, the exercises that we have. So 1 or 2 infections a year which probably would require an antibiotic also is still acceptable. And every 3rd month, every 4th month if you are getting infected, or maybe in a year if you take it's like more than 3 or 4 infections happening, then we will have to look into the reason why it is happening. So it is not that every sore throat or tonsil is ringing an alarm bell. In contrary to the popular belief, tonsils are not indicative of anything that is happening in the system. Usually the tonsils are there when the baby is born, and they kind of are very active during the first 4 to 5 years of life. During this period, if they happen to get infected frequently, they grow in size. Otherwise, in a normal human being, after 4-5 years of age, they become useless, they start shrinking, and in an normal adult, if you look at it, there will be a peanut sized non-functioning remnant of the tonsil will be there. If you see a bigger tonsil but not getting frequently infected, we don't need to worry about it. So that means size is not the factor which decides the surgery. Whereas if you see even a smaller tonsil but the person is getting throat infections, tonsil infections very frequently, then you can blame the tonsil for the problem and then you may have to get it removed. Or on the other hand, if the tonsils are too big and they are obstructing 3-dimensionally, they are so big that they are almost coming and touching each other, so the swallowing gets affected. If you look at it 3-dimensionally, the breathing passage in the back of the throat also, if it is getting compromised, then it is worth getting it removed. The size of the tonsil is not the factor which decides the surgery, rather whether it is getting infected frequently or acting like a source of infection or physically obstructing the swallowing or breathing passage. After evaluation, we determine whether that has to go or not. Yes, a strong yes there, because the acid is only meant to be in the stomach, right? However, the lower 1/3 of the foot pipe is still used to having a bit of acid every now and then. There also it is not 24/7 that acid is there like the stomach. And if the acid comes up to the lower 1/3 of the foot pipe, usually you really sense it. But if it starts coming up like a proper heartburn or a reflux, what we call, then you start seeing symptoms. So one of the most early symptoms or common symptoms that you will have in an acid reflux will be the throat irritation. And if a person is having frequent acid reflux, then there is a consistent flow of acid to the throat. The acid in the throat where it is not supposed to be, it's going to lead to a minor superficial burning of the skin, damage to the structures, and that will lead to throat irritation. So throat irritation is one of the most common symptoms for a frequent acid reflux. There are so many home remedies people have tried over the years. I think the most consistent one of them has been drinking something warm. Like people always say, drink some soups or drink some tea or something like that which is slightly warm. Yes, that really helps because the warmth soothes the throat and brings down the inflammation. The pain comes down at least temporarily. And chewing on a cardamom or a clove or pepper, ginger, or even some lozenges, pills kind of things on a need basis will also bring down the pain. Applying a bit of heat with a hot water bag or a towel dipped in hot water can also, applying heating pads can also soothe the throat. But these are all, so if the throat pain keeps getting worse, then it's probably good to go for medications. If it's a mild throat pain, we can manage with these kind of remedies.